So a lot of my focus tends to be on how to cope with stress. Stress takes on various forms, and you can have stress related to trauma. You can have stress related to workplace issues, to school, and recently I've been really um, asked to comment on the stress related to systemic racism. So that is something that I am passionate about. I also hold a patent. I have a patent pending invention for medication dispensation. So psychiatrists can both prescribe and do therapy. And I teach at Columbia and NYU. Um, so today's agenda, we are going to discuss the mental health challenges related to the pandemic. And we're going to review some cases. I think that it's very easy for people to learn when you use stories, a little bit more challenging when you just use a lot of data. So I think people can relate to stories. And then we're going to talk about practical skills for managing stress. We'll have a little bit of question and answer. So we know a lot about how mental health issues are studied based on previous pandemics. So yes, there have been previous pandemics, especially in other countries like Europe and Asia. We have a lot of data from their pandemic experiences. So at least we're not going blind here. We have data. And so it's really important that you have evidence-based medicine and evidence-based initiatives, because we want to use skills and techniques that work and that have been proven. And so there are really, and I left a lot of references in here so that people can go ahead and share this with others and learn more about it after the presentation, because it's a lot to take in. We know from the New England Journal of Medicine that during pandemics, people experience stress, they experience depression, and there are high risk groups. So we know that people who've been infected, actual patients, are more high risk. We know that the elderly are high risk, healthcare workers, people with pre-existing disabilities and pre-existing mental health issues and substance abuse issues. Healthcare workers have a lot of stress because they're on the forefront, obviously, and yet they're asked to do things that they may not necessarily feel comfortable with, but it's part of their duty. And just everyone on a day-to-day basis experience some level of insomnia, irritability, poor sleep, just feeling bored or frustrated in this situation. And we know that effective and rapid responses are proven to be helpful. So before the pandemic, families of color had to deal with systemic racism, right? We know from data that this causes kids to have high levels of stress. They actually have, it's medically and physiologically shown to cause cortisol levels to spike. And cortisol is a stress hormone. So when you're stressed, you go into fight or flight mode. So your body revs up as if it's preparing for war or attack. And over time, this systemic racism wears on the pediatric patient's body and mind, specifically our Black and brown youth. And so we had this before the pandemic, then you slap on the pandemic and that makes everything worse. Before the pandemic, access to mental health care, we know that there are healthcare disparities. We know that it's harder for Black and brown kids to get access to healthcare, and we know that the quality isn't necessarily equal. Well, we know it's not equal. And also there are unique challenges that each family faces, right? Depending on their child and their circumstance. And then we have this pandemic that further puts in this challenge of access to care. And then telemedicine is something we all have to get used to. Providers and clinics are getting used to this. Families have to get used to it. Then you have remote learning, which is new. Finances are unpredictable because the job market, we know it's not that great right now. Job loss is a key factor. Funding runs out. Education is unpredictable. So there are a lot of unknowns and uncertainties. And if you start off being stressed to begin with, then you add on all these uncertainties. Imagine what your brain goes through. When your brain perceives stress, your body reacts, you're in fight or flight, you can't think as clearly, and you tend to make poorer decisions. So having a stressful environment is not positive for anyone. So I like to learn with using cases that I've actually worked with. So this is a case of a 35-year-old Latina female that is in a unique situation. She is teaching and she's pregnant. And I disguise cases so that I don't reveal too much patient information, but I think that it's valuable to learn using cases. And then she now has to deal with, what if she gets infected? What if her baby gets infected, her unborn child? Then what if she brings it home to her other kids? Then there's the added female of being like a biracial um, Afro-Latina female. We know that there are risks about being a Black female in the workplace. We know that Black mothers don't get as adequate health care, and their outcomes for their unborn children are not equal to other racial groups. So she has this ethical dilemma. Does she have to go in and teach, and does she owe her kids their duties as an educator, or should she think about herself first? So and we know that she's not the only one who's thinking about this. A lot of people are essential workers. We know that Black females make up the majority of the essential workforce, and you know what, they don't have the best healthcare outcomes. So we're faced with, again, systemic racism during a pandemic and the stress and the added stress. And so with this particular person, we dove a little deeper. We looked at the mental health history. So she had a history of depression in college with binge drinking, and she was seeking help then. She had some really, problematic thoughts then. And she started to show signs of depression in the current episode. But back then she had, resources. She was able to go see her therapist. She was able to seek help. She was active in organizations that supported her. But now, you don't necessarily have access to those things. So for her, what we recommended was checking in with her provider again. I like to talk about medication because people don't like to talk about it. They want to hear tips and wellness and all that stuff. But some people do need medication, and that's okay. And so, she was able to consult and get that help. Before she used to go to spin classes, she couldn't do that. So the ways for her to cope weren't necessarily there. Before, she used to see her friends. Now she's pregnant and she doesn't want to expose others, or she doesn't want to get exposed. Before, she used to have play dates. She can't do that anymore. So we wanted to prepare her. So we thought about fighting stress through preparedness. We know from the Center of PTSD at the VA and through their task force that when you provide organizations with structure, with a plan, with preparedness, with trainings, the employees actually do better. So she felt like she was in the dark. Having people provide trainings and how to prepare yourself and how to deal with stress really helped her. And providing resources like counseling and information allowed her to feel more prepared at work in dealing with her student stress. We advised her to see a reproductive psychiatrist because she was worried about getting the right treatments during her pregnancy. And then she was active prior to the pandemic. So, there are ways that she could have become more involved with her organizations virtually. Maybe it was calling people up or feeling a part of a community without necessarily being there. And then I had another case of a business owner who he was in business with his best friend from high school. They owned a restaurant, and then that restaurant got hit because of shutdowns. And then when they were allowed to reopen, some people didn't want to come back. So particularly his business partner, got ill, and so it was down to him. And it was not a, like a ritzy business. It's just like a typical, place that like the communities go to. And they weren't making a lot of money to begin with. And now here they are. He's got to provide for his family. He's got to meet the needs of his employees. Some of the employees didn't want to come to work because they have pre-existing conditions. Some didn't have childcare. So, this is a community issue. And now they're at a breaking point. So, before, some people have a hard time admitting that they're struggling. This was one of those people. He was, first in his family to go to college, and he was seen as a success, and it was hard for him to admit that he needed help. But you know what? When small businesses suffer, they need to ask for help right away. And so also, he was dealing with a lot of the staff issues. Scheduling was getting complicated because, some of these employees had to take care of their own families. Morale was low. So we suggested he bring in an accountant, bring in an HR person right away, start dealing with this because this is not his expertise. He knew how to make good food, but he didn't know how to deal with these issues. Um, had regular team meetings with his staff so they could process how they're feeling, so they could talk about their fears and anxieties. It was helpful for him to know he should stop praising the people who were like, yeah, I'll come in, and kind of putting down the people who were afraid. Everyone's fear is valid. So work together. Let's talk about your fears. Hearing feedback from the team was very important. It was important to boost morale. And once he was open about receiving help and talking about things, the stress for him really decreased. And also he was bringing less stress home to his family. They were starting to feel it. So team stress is real. And I like to talk about the case of managing family stress. So there was a male nurse that we treated, and clearly he's not a nurse. I'm just describing. I'm trying to disguise the personal healthcare information so that we don't reveal who this person is. But they went from working on regular floors to now ICU units, and he was really stressed out. His daughter was having nightmares that he would die. His partner was worried about infecting the grandma who lives with them and takes care of them. So you have a whole family that's just really not dealing with this. He made the decision to sleep in Airbnb. So now he's away from his family, and they're worried about his daughter doesn't see him, so she's thinking the worst. His daddy's sick. Is grandma going to be safe? There are new challenges with his new job. Scheduling is different. There's a lack of support at home. And we know that children need information. They need structure to feel safe. This was new to him. He had never worn masks. So he wasn't even sure if he was wearing the protective equipment the right way. So he requested formal training. He didn't really know how to deal with ICU patients. And a lot of people working in healthcare were pulled from things that they knew how to do for years to things that they had no idea what to do. And this is real. This is happening. So he had to ask for a lot of help in terms of training there. Again, asking for help is key. I can't even emphasize that enough. So, and then the other thing was the night before he wasn't sure of where he was going to be assigned. So he started asking for the scheduling ahead of time because knowing where he was going helped to decrease his anticipatory anxiety. And then, a lot of times when we have settled into our job, we kind of lose connection with our mentors, people who helped us in childhood. We lose touch with those teachers and people who we admired and who used to give us advice on a day-to-day basis. We lose touch. We encourage this person to reach out to his former mentors. We encourage that person to reach out to their colleagues, co-students, and so forth, to talk to them about what they were doing and whether or not what they were doing was working or helping. And that really helped this individual. And then I have a case of pediatric stress. So I have we'll disguise this person. So this is the little boy who has ADHD. For people who don't know what that is, it's attentional issues. It's quite common. There's a debate as to whether or not it's being diagnosed more, or if it was always there and it was being labeled as something else. But this person had a lot of oppositional problems before the pandemic, and now they're at home. They have to do remote learning. They cannot sit still in front of a computer. They don't understand as much. They're seeing all these things in the news that are frightening, and they are really not doing well. The family calls the clinic repeatedly. They don't want to go into the ER. They don't want to come in because they don't want to get exposed, but at the same time, they really need a lot of help. And the entire clinic is overwhelmed. They don't know how to help this family. It seems like the outbursts at home are just getting worse and escalating. And, the family is feeling hopeless and they're projecting that feeling of hopelessness onto the clinic. So you have to validate the family's frustration. A lot of times with these families, you know, they yell at you and they say, "Why aren't you doing more?" Um, but then that it's because they're feeling hopeless, so they're projecting that onto you. And then the staff is, you know, overwhelmed. They don't know what to do from the clinic if the child and family doesn't want to come in. So it's they feel helpless as well. So then we get everyone on a team approach. We say, you know, we're a team, parents, child, and the clinic. We're all a team working to get this child to a place where they feel like they are capable and they're feeling better about themselves and they can manage their stress better. And you have to also acknowledge the family's limitations. Not everyone has the same training. Not everyone has the same degree of understanding. So we don't want to, you know, label people as good or bad. We want to say, you know, we're all in together, and we all have our strengths and weaknesses. For this person, you know, we really this family we wanted them to limit the amount of information that they were getting. You know, we all know families sometimes use Dr. Google, and Dr. Google can have a lot of information, right? That's not necessarily correct and or helpful. Um, and you also want to emphasize healthy lifestyle. So the basics, you know, getting good sleep, eating the right nutritious foods, taking care of your physical and physical health, because if your body is unhealthy, your mind will be unhealthy. We talk about building resilience. Well, you know, this is not your first crisis. What worked during the last crisis? What really helped you as a family to get through this? And go back to those basics. Focus on what you can control. You can't control what's happening in the news. You can't control the election. Yeah, you can vote, but then, you know, after that, there are things that you can't control. And so we tell families, like, let's look at the things that we can't control on one hand and the things that we can control. Do they overlap? Not really. So let's focus on what we can control, and stay connected. Reach out to other family members for help. A lot of times people feel a lot of shame and they don't want to admit when they are, you know, quote unquote failing. However, you know, you got to fail in order to succeed. And so, you know, reach out to the school for help. There may be someone at the school who is more of an ally, and you know, before, when you used to go to school and you weren't remote learning, it would be easy to access that person, but that person's still there, and you know, try and touch base with them even if you can't physically see them. Have a plan. You know, for this particular family, you know, things would go well and then we wouldn't hear from them, and then we'd hear from them in crisis. So it's like, well, you know what, let's not wait until we're in crisis mode. Let's start realizing what the triggers are. When do we know? What are the signs that things are not going well? Seek help. If you know, a lot of times, if you're not comfortable going into a clinic or a mental health place because you're afraid of, you know, what people will say, guess what? We're in the age of telemedicine now. People don't have to know, right? If you're really not over that stigma, you can seek out teletherapy in the privacy of your own home. And if you don't want to do that, if you're a religious person, reach out to, you know, your priest, your pastor. Um, and I love this resource. It's called Face COVID, and I put it in the list of resources for. They use an acronym that I think people can relate to. So again, we talked about what is in our control. So the F is focused on what you can control versus what you can't. Um, Acknowledge your thoughts and feelings. People have a hard time really, you know, saying, I'm not doing okay. There's like almost this perception that you're failing if you feel as if you're sadder or more anxious than other people. You don't know what other people are experiencing. You don't know necessarily that you're not alone. A lot of times it's hard to stay grounded. And so mindfulness is something that is being taught in a lot of schools now, how to just be present and focus on one thought or one thing. Even for a couple of minutes, it can really help you to come back to your body. Engaging in meaningful activities. What do you like to do? What are you good at? Everyone's good at something. Um, is there a way to fit that into your day to day? It could be as simple as doodling. Just, you know, it's things that allow you to feel accomplished and have a sense of achievement. You know, like, I'm a terrible cook. I never take up baking. I think a lot of my a lot of my patients will say like, so everyone's baking, and I'm like, well, if you don't like to bake, don't do it, because you're going to burn the house down, or you're going to make something that nobody wants to eat, and then you're not going to feel good about yourself. It doesn't have to be a big thing. If you think that you're really good at doing makeup or hair, then do your siblings hair or makeup. That having that little point of achievement in a day can really make a difference in terms of your mood. um, Committed action. So like, in this day and age when we see a lot of injustice, it makes us angry, and we should be angry. We're human beings, our brains are hardwired to seek justice and to want justice. So when we see injustice, we're supposed to feel angry. And we're supposed to have this reaction where we feel as if like, well, what's the point? A lot of times we say that, or we feel that. Well, you know what? This is not the first time in life that we've seen racial injustice. So we're learning about the past, going back to history and seeing what people did when they had even less rights. If they were able to make change, then we can too. So you can, as a family, get involved with um, uh, organizations that are really dedicated to fixing systemic racism or addressing it, and combating inequality and inequity. Um, Open up. Opening up for me as a therapist has been something that I've actually seen more of, because when people are kind of stuck in their homes together, you can't really hide how you're feeling. Parents are starting to say, "Oh, I noticed this and noticed that things I didn't notice before," or like, "Wow, like I had no idea my kid had such problems." Focusing on in school, because I'm never in school, but now that school is at home, I see all of these things. So like, open up and talk about these things. Go back to your values. What as a family keeps you grounded? What makes you different and unique as a family? One of the activities that I recommend for families is a COVID time capsule. And it's really like this very old-fashioned idea, but I think is becoming more popular, because you're in this together, and there's probably not likely to be another pandemic for years, if in our lifetime. So this is a unique time to capture these memories. How did you get through it together? So you can say, in one, we're going to create this time capsule, and we're going to put our memories in there, and our hobbies, and all these things, pictures and so forth, notes, projects. And then in a year, we'll dig it up and see what we did, how we got through this together. Identify resources. So, when you're stuck at home and you're not able to leave, fortunately, we're in the day and age of the internet, where we can actually look things up. We can gather resources, and it can be a bit more accessible. Um, and again, for people who are anxious and they're worried about getting ill, we're going into flu season. Allergy season is here. Everyone at some point has some symptoms of COVID. So like, do things where you feel as if you're being proactive and protecting yourself. Disinfect and distance. As we get to the holiday season, start making a plan to distance and to still enjoy the holidays. Don't wait until the week before Thanksgiving and you're like, well, I don't want to get grandma sick. I don't want to get this family member sick. Have a plan now, because these holidays are coming up, and rather than having another disappointment to face, this is not like last year, this is not like previous years. Well, what are we going to do as a family to still celebrate and still feel connected, so that it's not another disappointment? Um, and I worked on this piece with Med Circle about raising inclusive families and talking to kids about racism, and they have other videos, and I put them in the resources section of this. I think go ahead and check that out. It's really helpful. Oops, I don't know. I guess I put the video in here. This is an exercise. And I have, if you go to my Instagram, there are these 5 V's to thriving during COVID. A lot of them overlap with the face COVID, but again, I would say validating your fears, your feelings, venting, talking about them, going back to your values. I already mentioned that. Vitals, the basics, taking care of your body, your nutrition, your sleep, and then having a vision. This is the time capsule thing I'm talking about. Having something to look forward to in the future as a family. It could be a big trip. Like, it doesn't have to be like a fancy vacation. It could be a road trip somewhere. but something that you look forward to. It could be that time capsule we talked about, where you stay future oriented so that you're moving forward instead of feeling like there's really no point. Um, I don't know how you, let me see if I there we go. These are the references. I love this book. This is great for younger kids, and it's an online book resource. It's called I Have a Question. It's from the I Have a Question series, and so they allow families to use visuals, very simple graphics to talk about really complicated things like death. And then they have one that came out for coronavirus. I love it. I highly recommend it. Um, I have a list of resources for adults, for parents. So here's some literature on what we talked about. Like, again, this is not our first rodeo. Thank goodness there were other pandemics that we can learn from. For parents and caregivers, there's also the Hello, I'm a Virus book. For kids who can't travel due to disabilities, or just like people are just nervous or just lack of resources, there's this visual field trip where it shows you, like, it takes you to different like museums and kids places, so you can watch that as a family together. And then for teams and employees, and just resources for coping with racism as a family. So we can go to the question and answers.
Thank you. Are there any questions or answers, especially around the racism? Let me ask you one thing. You know, Doctor, I believe a lot of us are very hopeful that the political environment will change, hopefully in November, December timeframe. But what if it doesn't? How would you guide us in coping with what is happening and what will continue to happen?
You know, I think that especially from the last election, we learned that a lot of people, especially children and females, really, and minorities, really struggled with that. And how is it possible? Again, as humans, we have a hard time with injustice. And so I think for parents to tell their children, no matter what happens with this election, no matter what, I'm going to protect you. We're going to continue to stay active in our local initiatives. We're going to continue to, as a community, to persevere, to do our best to fight injustice, no matter what. Because guess what? Even with a change in administration, you still have to deal with systemic racism, and 4 years is not a lot of time to change a lot of things. So we have this fight is we're going to continue this fight as a family no matter what happens. And I think that again, we talked about like things you can't control and things you can. Really focus on what you can control is very powerful, because when you try to go ahead and tackle the other thing, you're really wasting your time and your resources, and you're getting more frustrated because you can't control those things, right? So focusing on things that you can control is so key, and really reminding your kids about, this is what we can do every day, and what's really inspiring to families is, we're not waiting for someone else to save us. We're going to fight towards this. We're going to do something about it. We're going to learn about this. And I think that's empowering. So no matter what happens in terms of the election and the administration, we're going to persevere, and we're going to keep being active.
Thank you.
Mm-hmm.
We have a question from Alicia. You can go ahead.
Oh, I didn't know if you wanted us to raise hands or not. Just for the sake of keeping order. On a related note, how do you advise we cope or work around the fact that there's very few, or we know that there's a shortage of mental health practitioners of color? How do we find practitioners who can actually help us work through the stress that comes from racial injustice?
I've done a fair amount of work in cultural psychiatry and cultural competency. And just because you have a provider of color doesn't mean that they're necessarily culturally competent, right? And so if you're having a hard time, yes, it's easier to open up, I agree, to someone who looks like you, who's been through potentially what you've been through. Um, and at the same time, if you are having a hard time finding someone that looks like you can reach out and try to find people who are culturally competent. I tend to use a research called Psychology Today. I mean, and I think that you can use it's a nationwide resource, and you can actually put in a search for the type of your insurance and cultural competency, and it'll come up. And this is for people who want to find someone to help them with specific things. So you can even put in a specific search for like things like ADHD, or is my child having gender identity issues? And those providers will come up because when providers sign up for this website, you have to put in the things that you have specific training in. And you can find people who are culturally competent who don't necessarily look like you. It is a problem, though. It's a problem that we don't have enough Black and Brown providers of color. I'm working with an initiative with Dr. Oz right now, More Black Doctors, where we're trying to mentor young Black doctors, young Black scientists to go into these fields that are underserved, because there are just not enough of us. And at the same time, there are some providers who have taken that additional training because they want to reach out to communities that don't necessarily have representation.
Hello.
Hi.
Thank you, Dr. Judith, for sharing your expertise and your knowledge with us this morning. It was very, very insightful. I missed the first few minutes, unfortunately, but the information that I did hear and see is certainly very valuable in these trying times. We don't know what we don't know. And sometimes when things are put in front of us, it makes us think about some of the things that we don't typically think about. So your tips were very helpful, and I appreciate that. I don't have a question, but I just want to know, well, the question is, can you put the resources back up?
Yeah, I'll send out a document with the resources for sure.
Thank you.
Yes. Mhm.
We have another question from Christopher Rowe.
Hello, Judith. Thank you very much for the lovely invite to this amazing lecture. My question is actually regarding supporting other family members in regards to their mental health. So we, in the UK, which is where I am based, and the way it works here is we're sort of encouraged to live in little social bubbles, just sort of in your neighborhoods, because of the disease here is still spreading like wildfire like it is in America. So my question is, we have elderly relatives with disabilities. One in particular has dementia, so she's not very technologically able, for example. So how would you sort of go about trying to support her mental health without sort of putting her at too much risk from the disease, so to speak?
That's a great question. And I do a lot of research in Alzheimer's dementia. And again, I'll give you what I tell my patients, and please seek treatment with your provider. But with my patients, what I'll tell you is that with dementia, orientation is really important. So for those who don't know what dementia necessarily means, it's not just Alzheimer's type. Dementia is when you have specific problems related to memory, problem solving, and orientation. Orientation is what day is it? What time is it? Where am I? Who am I? There are specific diseases that can lead to dementia. It could be Alzheimer's dementia, Parkinson's dementia, strokes, and frontal lobe. There's all these different types. But essentially, people have challenges with what I mentioned. And so there's something called like the brief psychiatric intervention. There's a manual that's given out to families, and it allows them to help their loved ones to stay oriented. And so one of the interventions in this is having that person surrounded by transitional objects. Transitional objects are things that reminded them of happier times. Some people with dementia or memory problems can become quite stressed and anxious and depressed. And a way to help them to soothe is to surround them by things that orient them. So it could be if your loved one had a trophy at one point in their lives, or if your loved one did something amazing, right? Something related to military or whatever, have that person surrounded by these transitional objects that remind them of positive times, because our brains are odd that way. On an unconscious level, when we have these objects in the environment, they can really help to ground us and to give us a sense of satisfaction. The other thing is, with dementia, there's something called sundowning. So the later it is in the afternoon, the more disoriented or confused a person gets. So try to keep them on as regular a schedule or routine as possible. So it may be waking them up at a certain time of the day, having a clock, right? Or saying it's 9 a.m. and today is like a calendar, this day, just keeping them oriented and on a regular schedule is very helpful. A lot of times people who are elderly have to isolate because they, can get ill. So they feel disconnected from their communities. If they were involved, let's say in a church or a parish, sometimes, these churches are like not really full. They can't be full, they're empty. And so you have a lot of people who are still working in the church that don't have a lot to do. So I've been encouraging the families to reach out to the church members and say, Pastor so-and-so, can you call grandma, once a week and just let her know what's happening in the church? Or it doesn't even have to be the pastor. It could just be sister so-and-so or brother so-and-so. Can you just like check in with grandma or, auntie and, let them know what's happening? Can you pray with them over the phone? Can you guys do a little Bible study over the phone? You'd be surprised at how willing people are to do things like that. Things like music that remind elderly people or cognitively challenged people of happier times, things like music can be really helpful. So like playing music around food, like meals can really allow them to have a sense of joy so that they get through a meal, because a lot of times people with dementia, they lose their appetite and then they literally starve. So having positive and pleasurable things around mealtime can be important. With families that I work with, having a lot of sunlight, natural sunlight in the windows, the blinds up, can help them to feel regulated. And also melatonin is really dependent on the amount of natural sun exposure that you get. And sometimes people, want to keep elderly people like in a place where they won't fall, but move that bed or that chair close to the window so they get natural sunlight. So there are things that you can do that help people with dementia or memory problems. One of the things that I've in recent cases found is that if an elderly person at a home or a person with disabilities or challenges in a home really connected to one employee there, and that one employee had to leave because of COVID or something, have that person reach out to that individual using FaceTime or using some digital platform, because sometimes people connect to just one person and you don't realize they're experiencing a depression because that one person has left. And so if your family member worked well with a caretaker, one particular caretaker, then try your best to keep that relationship alive.
Thank you, Dr. Joseph. I have a question about the children that we have in our lives. I know a lot of times kids, they're still learning how to express themselves. And so they might not come out and just say, this is bothering me, or they might not say exactly how they feel. But especially during a time such as this with coronavirus and politics and the racial injustice that a lot of kids are aware of because of the news, how can we kind of check in on them and just kind of do like the people who are around them do temperature checks just to make sure they're doing all right and to let them know that we're there for them and they can talk to us?
So I'm a big believer in the family meeting. So I think it's an idea that isn't utilized enough, and like I think that families are like small little like corporations, so they need to have regular meetings. And I think this is an opportunity to start this old-fashioned tradition, and make it a new tradition for your family. Regular family meetings where everyone has a chance, even the littlest one, to raise their hand and to have the floor. And it also teaches children how to, speak in public, and it teaches them that their ideas and their feelings are valid. You may not agree, but that's the one. People can't take your feelings from you. How you feel is how you feel. And so, when you do talk to children about things, rather than asking yes or no questions like, "Are you sad? Are you stressed? Is something wrong?" Um, that doesn't help children. It makes them shut down. First of all, they mirror what you're experiencing. So they're like, "Oh, you're stressed. I should be worried too. I'm just gonna like ignore that." Try your best to first take care of your anxiety. Make sure that you are mirroring the appropriate reactions so that your child can open up, and ask open-ended questions. What have you learned about that? That allows a kid to be like, well, so-and-so told me this, or I saw this on, social media. How do you feel about that? That's not yes or no. That's like a very open. And then when your child tells you something, even if you think that your child's opinion is wrong, you don't say it. It's an opportunity for discussion. Oh, like I wonder what that's about. Like things like that allows your kid to feel like, oh, my opinion matters, my thoughts. You care about my thoughts, and so it gets rid of that type of environment that is stressful for a child to share. Younger children are not as verbal. So when they're stressed, you see things like regression, you see bedwetting, thumb sucking, acting out, oppositional behavior. Sometimes kids stutter or stammer. And so for them, their hands are really important for how they interact with the environment. So you can use things like getting on their level, getting on the floor with them, getting close to the table with them, and drawing together. And while you're drawing, like, let's draw a picture of our family. And that's something that I really missed from my sessions, because a lot of my sessions have turned to telemedicine. It's really like drawing with the child, and oh, draw your school for me, draw your family with me. And then you'll see these themes come out in the art that you're like, wow, you learned so much from the way a child sees the world through their drawings. And so your child may draw their family, and you'll see, one family member looks really big, even though they're smaller, and then another family member looking really tiny. And that tells you, oh, like this child sees this person as the most powerful person in the family. And what is that about? Like they may draw their younger sibling as being huge. Well, maybe they're getting more attention, or maybe the child perceives that, or they draw mom with a face that looks like angry. And it's like, oh, does my child think that I'm angry? Let's talk about that. So, art can really help a family to communicate when a child is not able to verbalize how they're feeling.
Thank you.
You're welcome.
I have a second question. If nobody else is pressing it or jumping to ask one. What do you suggest people who both live alone and don't have that family's comfort and support right now, but are also just living through serious Zoom fatigue after like 6 hours of Zoom meetings a day? What do you suggest they do to remain connected, but also just like taking care of themselves?
So families that don't have, it's like a single parent family, or
people who just live alone.
Okay.
Like my roommates or dogs.
Got it. Yeah, I mean, this comes up a lot, especially in Manhattan, where everyone's kind of left. And so, I think that no one's really alone, right? We're not living in a planet where there are 0 people. And I find this, especially in Manhattan, I don't know if anyone has lived here or been here. Here, it's like you can be in an apartment building with like 100 other families and never know your neighbor, right? And so I'm seeing this a lot with these like single professionals I treat. They're starting to feel like, I feel like I'm in a sci-fi movie where there's like no one in the city but me. And so, well, what about the guy who works in your building, the one who brings your packages? Do you ever say hello to that person? Do you ever just like start go beyond a conversation of thank you with the cashier, right? And it sounds very silly, but for people who are depressed and anxious, having that little further interaction with a person in their environment, in their little ecosystem, in their world, allows them to feel connected and seen. So there are ways to still interact when you are, alone or isolated. And I agree. I think Zoom fatigue is real. We're on our computers for learning. We're on our computers to see our doctors, to see our family members. It's a lot, and it's okay to say, I don't want to like join this Zoom. I have some patients who are like, I don't want to do another Zoom happy hour. I'm tired of it. Like, I don't want to. Well, then don't do it. It's okay to say no, and check in with that person over a phone call. Go on a walk with that person visually. There are these apps that I recommend. One of them is Strava, and you can feel connected to a friend through an activity without actually having to talk or see them. And that app allows you to say, okay, I'm going on a walk. So that person can see how many miles you walked. And then you can see how many miles that person biked or so forth. So you still feel as if you're part of a community, but you're not necessarily like there. Because the Zoom has a lot of pressure. You have to do your makeup. The house has to be clean. You got to have something interesting to talk about. And it's exhausting. And I'm a firm believer in movement. And so for some of my patients, learning something in your home that has to do with movement, like if you're not necessarily like a professional dancer or have any like dance history, but you've always wanted to learn how to salsa, well, I'm going to learn on YouTube is a wonderful teacher. I'm going to learn how to do a new move on YouTube. And then I'm going to post it or send it to my friend, and like your friend responds and it's like, oh, that's really funny, or that looks great, or like keep it up, things like that. People learning new yoga poses. One of my clients does that and shares it with her friend without having to talk or Zoom, and they exchange and share that way. You can still find meaningful connections without having to like constantly Zoom or FaceTime.
I have a question too. My name is Jill LaFavors. I have a teenager who is doing the virtual learning now. And one thing I'm finding is that in some of the classes, and specifically for this semester, his US history class, the teacher kind of says some things, because I'm always in the background, that are not necessarily correct with respect to African Americans, our journey here and our history here. And so I'll hear her say certain things that she believes, and then there are other things that I say. So example, yesterday, she was talking about how George Washington has just not gotten his just rewards, and he's gotten a bad rap, and this and that and the other. And she ended up saying, and a lot of them have because they were slave owners. And so then she said, however, he was a slave owner, but he was the only one that in his will stated that his slaves should be freed when he died. And so all the kids were like, oh, okay. So me in the background has to jump in and say, and ask her if that happened. And then she comes back and says, well, no, it didn't happen. It happened about 80 years later after the war. And so it's just me constantly having to kind of get to or help him understand what really happened, as opposed to what is being taught, which is just a lot of times not the truth. And so my question is, I don't want him to feel stressed, like I'm listening to the teacher, but then I have to ask my mom, or I'm listening to the teacher and then I have to wait to see what my mom says. So what do you suggest in those instances?
So, I mean, misinformation and just outright a lack of truth in education is something that I think that it needs to be addressed. I can't give you advice, but I can tell you what I've done with what I've seen with some of my other patients. I've seen parents get involved with the school and become really active members of the PTA and talk about their problems with specific problematic teachers, and their strength in numbers. if you're probably not the only parent who's experiencing this or upset about this. And so if you can find more of like a community within the parents of the school, I think your voice would be heard. And also just, bringing it up with a counselor in school and saying, this is how it's causing my child to feel stressed and something needs to be done about this. So, I don't think you should ignore it. And I'm a very strong advocate for teaching your children history because you don't know what they're learning in school. Just like you can teach your kids about a lot of things that you want them to get the information from you first about, such as like sex or gender stuff and all that. So, I think that there's strength in numbers if you can find a way to become active in your PTA. And also just like talking about it with a counselor in the school, they're still there. Even if your child isn't physically going to school, they're still available. And so you can find your allies within the school system, be it another parent or someone who works there.
Thank you.
You're welcome.
Hi, Dr. Judith. I have a question. Where would you say that people need to, I guess, where would you draw the line between interacting with others and like engaging and sharing how you're feeling at the moment versus just like really noticing like, okay, now is the time for me to just kind of process on my own to avoid projecting onto others. Like, for example, if it is older family members, like that need to process through instead of like taking it out maybe on like a younger family member. Like how would you advise with that?
So you mean processing your feelings so that you don't overwhelm others?
Yes. Yeah.
I mean, I'm a huge believer in therapy, right? I mean, your family member should not be your therapist. Your parents, yeah, it's important to communicate, but there's a reason people go to school. There's this doctor, I forget her name. She says, like a lot of her patients get advice from like these online or Instagram mental health people, but it's like to be a therapist, you got to go through 12 years of high school, 4 years of college, depending on what your degree is. You have to do a master's or you go to medical school and then 4 years of residency. So you're talking about people who've like dedicated years, decades of their lives to training versus like, talking about your problems with your friends, right? So it's like therapy now more than ever is more accessible because of telemedicine and people being open to it, and also more providers allowing themselves to get on these platforms. Before, people were really like against it, they were like anxious about it, but now we have no choice. So I feel like, I will always say start with a therapist. I think therapy can be life-changing, and you may not find the right therapist the first time around, and that's okay. Just like you should ask and interview your doctors, be it whatever specialty. Like, are you used to treating people like this? And what's your success outcome? What's your, what makes you qualified? So finding the right fit is really important. And then when you find the right fit, therapy can be life-changing, and it allows you to develop this professional, confidential relationship with someone who can tailor a treatment specific to you. And so if you find yourself having interpersonal interactions where your family is becoming overwhelmed or you're becoming overwhelmed, maybe it's time, to start that relationship.
Thank you.
You're welcome.
Dr. Joseph, as you well know, that many people of color do not try to handle their own problems. Usually they'll say, God will help me, et cetera, and they really don't look to therapy as an answer for their issues. And maybe that's what Marilyn was also indicating. And so how would you guide these people? I even know in my own family, in my husband's family, people, his parents, et cetera, and others think that way.
I grew up in a Trinidadian family where my dad is a pastor, still has a congregation. and my mom is a very active pastor's wife. I can't tell you how many times I saw schizophrenia, OCD, bipolar depression. And like back then, it was like, we got to pray about it. Like prayer is important, don't get me wrong. But then like there are true things that need to be addressed, right? Like there are things that are not within the person's control. It's not their fault. It's not a default. They didn't do anything where there's a curse. Like it just so happens that it runs in their family. It's genetic, and medication and therapy help, right? And so, I still have this conversation with my dad to this day, who is an 80-year-old pastor who's now like, we're getting training in mental health and counseling now. So it's like the church is actually becoming very active, and some churches I think have a ways to go, but a lot of church communities are starting to embrace the idea of, okay, we can use religion and faith plus, learning mental health basic skills. I mean, I don't know what it's like there, but here there is something called like mental health basic skills, and like it's like mental health first aid, and family members, community members. You don't have to have like a degree. You can go and get training in it, and churches are doing it so that they can provide like very basic fundamental support to people who have mental health crises within their congregation. So one place to start for people who are not believers in like mental health is going to the church counselor, and so if you don't feel like the church counselor is skilled and equipped, really starting with your provider in your primary care office and trying to find resources that way, or even in the school counselors are trained to deal with these things as well, and so I think that people are starting to change. I think communities are starting to shift towards, okay, mental health issues are equally or more important, even more important than the physical health issues, because this idea of the mental health checkup is starting to catch on. That like, okay, we go to a doctor every year for our physical health. Why aren't we not doing the mental health check-in? So a lot of physical health doctors are starting to do that in their offices. They're starting to have screenings in pediatric offices. It's actually mandated that you're supposed to like ask certain questions when a child goes in for their checkup, because 1 in 5 children has depression. ADHD is very common. Anxiety is extremely common. So we're starting to realize that this is more common, and there's a name for it, and there are treatments. And if you're not getting the evidence-based treatment, then you're really doing yourself a disservice. Why not? Why are you not good enough? Why are you not worthy enough of getting what is evidence-based, what is proven to work? Why treat it in a way that has never been researched, has never been proven? You're really just taking a gamble with your own wellness.
Thank you, Dr. Joseph.
Thank you.
Thank you. On behalf of the foundation, I would just like to thank you for joining us today. It's been very valuable, I know, for our entire community, because a lot of people are in similar situations as the stories that you shared with us today. And so I hope that we can all learn from what we heard from you. And you will be sending the slides and the resources that you showed. And so I'll make sure that I distribute that to all of our participants today. And thank you all for your questions as well. And we're so happy that you could join us on this Saturday.
Thank you.
Mrs. Welters or Jay, do you guys have anything you want to add before we wish everyone a happy Saturday?
I think you summed it up well. And just thank you for your time. And hopefully this will not be a one-off, because we have a lot of things to climb out of during this period. So I thank you. And Jay?
Thank you so much for taking the time. And as Jalicia said, it's an invaluable resource, and I'm just grateful that we're able to connect in this way and just learn so much together.
Well, thank you for your wonderful questions and for listening. We're all in it together.
Yes.
Thank you.
Have a great Saturday, everyone. Thank you.
Thank you.
You too.
Bye-bye.
Thank you. Thank you, everyone.
Thanks.
Yeah.
Hello.
Good morning, Miss